Before I introduce our President and CEO, Michelle Nunn, we're delighted to be joined today by guest speakers, Senator Chris Coons of Delaware, Dr. Margaret Hamburg, former Commissioner of the FDA, Michelle Flournoy of West Exec Advisors and the CARE Board, former Representative Jim Moran, and CARE colleagues Benoit Munch and Chris Noble. Benoit is joining us from the Democratic Republic of Congo. So let's get started with CARE President and CEO Michelle Nunn. Michelle?
Thanks, Beth. I am really glad to have the opportunity to be with y'all. It's a difficult time, but I feel like it is exactly the time for CARE. And we're taking a lot of inspiration in heart from our history. Clarence talked about the more recent history, but also if you think about it, we've heard from many, including the Secretary General, that this is the greatest generational challenge that we've had, or perhaps the greatest challenge since the founding of the UN, which also happens to coincide with the founding of CARE. So we're really proud of the response, and you're going to get to hear a little bit from Benoit about the COVID response that CARE is mounting, but we're particularly grateful to have an extraordinary assemblage here today of leaders who are helping shape not only our country, but also the global response, because I think we all recognize on this call that no community will be safe until all communities are safe, and that we really must have an international response here. So we're going to get to talk about that and to hear about that. There is no better leader or representative to that understanding of our interdependence and the leadership of America as a humanitarian nation than Senator Chris Coons. And I won't go through the fulsome bio of Chris because I think it's well known to this group, and I want to save that time for him. But I will just say that when I lapse into moments of despair about whether we are going to rise to this challenge, I think of Chris and others like him that are leading our nation with integrity and with foresight and with a spirit of collaboration and great passion. And so, Chris, I am incredibly grateful. I hope that you're able to hear and join us. And Chris has spent time traveling with CARE, seeing our work ranging from India to Uganda and countless countries that he has visited on the African subcontinent and around the world in his representation around the Foreign Relations Committee. So, Chris, I would think we would all love to hear your perspective and reflections at this moment.
Thank you, Michelle. Can you hear me?
We can hear you, yes.
Fabulous. Michelle, thank you so much for your leadership of CARE and for all that your remarkable network of professionals, partners, and supporters around the world are doing to help make sure that we meet the daily needs of tens of millions of people, but also in this particular moment of global crisis to remind us of how CARE's own founding in the response to the Second World War was one of the signature moments when Americans showed their compassion for and connectedness to others around the world. Clarence, it is great to be with you, if virtually. Just by happy coincidence, the picture that is right there over my shoulder is of President Ellen Johnson Sirleaf and me together. We had a number of opportunities to work together and meet together. And I spent time in Liberia with her during the Ebola epidemic that really launched my interest in and concern about global pandemic preparedness and response. I've also had the blessing of traveling with Michelle and a number of folks on this call, some of the CARE team, to a number of countries, to India and Nepal, along with my great colleague, Senator Jeff Merkley, and to Uganda just this past August, along with Senator Van Hollen. These have been important educational opportunities that have given me and members of my team direct exposure to the wonderful work that CARE does around the world. Let me just briefly say that I think it is demonstrably in America's national security interest to make sure that this pandemic is combated globally. Most American elected officials are understandably almost uniquely focused at this moment on pandemic response and containment here domestically. And it has been a struggle in calls with a number of my colleagues to get them to embrace and respond to the idea that this is a critical international moment for the United States to show its engagement, its effectiveness, and its compassion for the rest of the world. But I intend to make that case in particular to advocate for $12 billion in additional appropriations through the State and Foreign Operations Subcommittee that will help strengthen the public health system, strengthen the equipping and the personnel and the response as the United States gets to a place where we hopefully have a robust supply of PPE, the development of an effective therapeutic, and God willing, someday soon, an effective and safe vaccine. I think the United States needs to see this as a moment where we have resources, ideas, energy, and hope to spread to the rest of the world. So let me stop there because I know we have so many other speakers. I'm eager to take questions from folks on this call, and I am so grateful for all that CARE is doing and that we will do in partnership going forward.
Chris, thank you so much for your leadership and for being a part of this call. Incredibly generous of you. So I know that you will have to step off. I imagine that you're going to have to step off. Can I just ask you on behalf of all of us what your advice is for how we as citizens and as an organization can encourage that perspective of international response and that investment that's going to be so important?
You know, first, it's just by reminding everyone you can talk to, and I literally just finished a call with a senior Republican appropriator in the health and human services space. Just selfishly, we will not be safe until this global pandemic is resolved globally, as has been the case in other pandemics, whether HIV/AIDS or Zika, whether SARS or MERS. When they spread globally, you really can't, as much as our president would like to believe this, you really can't build walls and shut down immigration and actually isolate the United States from the rest of the world in an ethical and effective way. So first, just selfishly, we're not going to be able to resolve this pandemic and reopen our society and economy unless and until we help the rest of the world. Second, China, which is our peer competitor across so many different areas right now, is seeing this moment as an opportunity for pandemic response diplomacy. And they are shipping badly needed PPE and testing materials and other equipment around the world to groups and countries that are in significant need. The United States has for decades distinguished itself as the principal funder of hunger relief, of humanitarian and disaster assistance, and in particular of the largest public health intervention in human history around HIV/AIDS. Why would we relinquish our values leadership, the significance that we can show about the response of an open society, a democratic society in this moment? So I think we can make ethical and humanitarian arguments. I think we can make national security and self-interest arguments. And I think we have to lift the eyes of the average American from the immediate crisis right in front of us to recognize that if we don't take steps to help stabilize the economies of dozens of emerging markets that have critical debt problems right now, and if we don't raise our eyes and in partnership with global organizations like CARE, deliver badly needed and greatly deserved humanitarian assistance, then a moment for us to reassert our place at the table globally will pass us by.
So, Chris, maybe I'll sneak in one last question that is on the chat, and then I'll let you transition. There is a question from Kimberly Flowers who says, who are the Republicans that you're working with on the global response and that are being real partners to you in this? And are you feeling that we have the support required right now to get the additional $12 billion?
No, I am not confident that we have the support we need for $12 billion additional dollars. I will tell you that the majority of current conversations and activity really is focused on the bill that may be passed at 4 o'clock today in the Senate. This is a bill that is very narrowly focused on small business, small nonprofits, on hospitals and healthcare systems, on tracing. 90% of the energy and the conversation I'm having with other members is around immediate domestic response. Senator Graham continues to be someone I look to in his leadership on SFOPS, and Senator Leahy continues to be someone I look to for his leadership on SFOPS as the chair and the ranking Republican and Democrat. And I am cautiously optimistic of their support. But bluntly, I could really use help. We could really use help together in engaging other Republicans who in the past have stepped up to defend the 150 account. There's a transition underway at USAID, and I am concerned that in the absence of real effective and engaged advocacy, we may see this administration's vision, which is to dramatically cut foreign assistance, carried out. That's not meant in any way disrespectfully about the nominee to be the acting administrator. Excuse me. That's not meant in any way to disrespect the acting administrator who may or may not be the nominee, Mr. Barca. It's just to recognize that Mark Green has been a wonderful advocate and leader of USAID, and we have a number of Republican appropriators who have embraced sustaining our 150 account, trying to not just defend it from cuts, but to increase it in this environment will be a challenge, and I really welcome advice and help from everyone on this call.
Well, Chris, thank you for all that you're doing. I think that you've given us some important marching orders, and we all want to support your leadership. And we have a huge debt of gratitude for all that you're doing. So thank you on behalf of CARE and on behalf of all of us. So I'm gonna shift now to give you all a little bit of a moment to hear about CARE's response on the ground around the world. We are operating in 100 countries. In 64 of them, we've mounted some sort of operational response, and we are really grateful for the extraordinary leadership of team members around the world who are doing the important work of providing community education, of providing water and sanitation and health support, of looking at the gendered response here, of the disproportionate impact around women in the sense of the most vulnerable in society, 70% of the caregivers. So even if they're not clinically most vulnerable from a societal perspective, they are. The teams are doing heroic work, and so I'm going to ask Benoit, who is our country director in the DRC, to give us a window into that work, and also clearly building upon the foundation of the Ebola response and a set of humanitarian fragility in the DRC that is quite difficult and challenging. So Benoit, can you give us a portrait of the work that you're doing?
Yes, thanks, Michelle. Thanks for the opportunity to talk a bit about DRC and the work that CARE is doing there. Just for the moment, in DRC, we are at the beginning of the outbreak. We have less than 400 cases, but we know also that we already have local contamination in the capital, Kinshasa, which is more than 10 million people. And we know that in the coming weeks, we will see an increase of cases very quickly. We know also that the coronavirus cases are also in the eastern part of the country, and you see a picture of what we could see in the eastern part of the country, because it's also affected by conflict and affected also by the current Ebola outbreak. That means that we have a country that is affected by different kind of challenges. This is before the coronavirus crisis. DRC was already one of the biggest humanitarian crises in the world, with more than 15 million people in need of food assistance for this year. And all this kind of activity that need to continue right now, despite the coronavirus and the different kind of restriction of movement. In terms of response capacity from the government, we have less than 70 respirators in country for a population of 90 million. That means that we know that if the number of cases increase and severe cases appear, we'll have really low capacity at the government level to really respond, and clearly the health system will be totally overwhelmed. To give a comparison, in 18 months, we had less than 4,000 cases of Ebola, and we were already stretched. That means we could imagine if we have the same number of cases than we have in Europe or in the US, in DRC, the mortality rate will be very important. And that's why CARE is clearly working on providing support to the health system, continuing the Ebola response and the support that we are doing in supporting health center, but also really working hand in hand with the community, because they will be also the first responder on the ground and making sure that they will respect the different kind of prevention measure from Ebola, from coronavirus, sorry. We all would also have Ebola right now. Maybe one of the things that make really DRC different, and even if it's the case in a lot of African countries, is the issue with confinement that is really almost impossible in this kind of context, because most of the people are relying on daily labor because of the informal sector, because most of the people are working in the informal sector, and this kind of things create a difficulty to ask people to stay at home. That's why we are trying to find other way of supporting people in that. And we already see a lot of impacts, especially on women who are normally working in the market and selling like basic food items that are now less available. And also, you know, a lot of markets have been closed because of the restriction and because of the prevention measures. That means a lot of people already doesn't have any kind of daily income. And this is something that we are expecting to exacerbate in the coming weeks and months.
Well, thank you so much, Benoit. We wish you just a safety and health, and thank you for everything you're doing there on the front lines, and we're supporting you. And the people on this call are here because they care about it, and we salute what you're doing, and we'll keep supporting you. So thank you. It would be hard to find somebody more qualified to talk about this pandemic than our next guest, Dr. Peggy Hamburg. Peggy trained at Harvard Medical School. She was Commissioner of Public Health in New York City earlier in her career. She went on to senior leadership roles at the NIH and served for 6 years, I think that's a record, as Commissioner of the Food and Drug Administration in the United States. In between, she spearheaded pandemic modeling and response efforts at the Nuclear Threat Initiative. Peggy, you've been studying pandemics for a long time. Is this what was expected? How is it different from what was predicted, and how are we handling it worldwide?
Well, first, let me say how grateful I am to be brought into this amazing community of CARE, and it's inspiring to see the leadership of CARE, Michelle and her extraordinary team, and also the leadership on the ground that we just heard from in the DRC, and the leadership on the Hill coming together around this important problem. You know, the thing about pandemics is that you don't know what to expect, but in many ways, this could have been predicted in terms of our knowledge about emerging infectious disease threats and our increasing vulnerabilities in terms of international trade and travel and urban crowding and other risks. It is extraordinary now to realize that we didn't even recognize this virus some 4 months ago, and now around the world, cases have reached almost 2.5 million. The United States, sadly, has the dubious distinction of having the most cases in the world, although we would have assumed we would have been the most prepared country in terms of ability to respond. And we are beginning to see some encouraging signs, but new cases and death tolls continue to be dramatic in our country and elsewhere. In response to a pandemic, including this one, it is anticipated, if it's a novel pathogen, that it will take time to mobilize the scientific community in the ways necessary to create the new drugs and hopefully a vaccine or vaccines to give us the medical management tools that we need. The non-pharmaceutical interventions that people are using now, social distancing, personal hygiene, infection control, all of those are critical and they're making a difference. The whole world is trying to undertake a number of tasks as we grapple with this unfolding global pandemic. Reduce the number of infections and community spread, take care of those who are sick and limit the number of deaths, and reduce the social disruptions and economic and other follow-ons that, of course, are having devastating impacts. As I look at where we are, I'm frankly surprised that the social distancing has been as effective as it has been in many countries, although we certainly just heard about and could visualize the challenges in many parts of the world, like DRC. But we are hopefully very soon going to see some therapeutics becoming available. The first ones will probably be only marginally effective, some of the repurposed drugs, but understanding the nature of this novel virus and developing targeted drugs is going to bring us better solutions. A vaccine is the ultimate protection. It's further down the road. Vaccine development is always uncertain, always risky, but there are many, many, more than 70 vaccine candidates currently under development, and in about 7 different categories of vaccine, and moving very, very swiftly. Efforts are being made to really coordinate and collaborate in new ways, public-private partnerships and international collaboration, which is very promising, and thinking not only about how to streamline the development, the research and development process as much as possible, but also to start to gear up now so that we can scale up and manufacture in the volumes needed. So there's a lot going on. There's a lot of reason for hope, but we have to, keep a all hands on deck attitude about the work to be done. And we have to make sure that once we advance scientifically, we actually deliver on this promise of science and technology for all those in need.
Thank you, Peggy. There's been concern that while the focus completely turns to COVID-19, that other serious public health problems won't be addressed. And I heard yesterday somebody worried about rolling back the clock on 15 years of progress in other areas. Can you address the dangers that are posed in that way?
Well, I think this is a very serious concern, and in the focus on coronavirus and the mobilization, which has been appropriate, I think that this has not gotten the attention that it deserves, and we need to address it. There are serious problems that have to do with the disruptions in critical supply chains, so that drugs and medical devices that are made in whole or in part in different parts of the world are now coming into shortage. Some of that matters for COVID-19. Some of it matters for routine medical care, and that is affecting lives here. It's affecting lives in other countries as well. We're also, because of the social distancing and the efforts to not overwhelm our healthcare system, again, in this country and in many other places, we're seeing important but more routine medical care going undelivered, whether it's responding to strokes and heart disease, the management of diabetes or asthma attacks. That is creating serious reason for concern. And you look internationally, unfortunately, what's going on with coronavirus is making it very hard to deliver certain aspects of primary care that so much matter to the health and well-being of communities, including routine vaccination campaigns, which will impact the future health of our children.
You mentioned, Peggy, that the issue of measles that happened in an earlier pandemic, where there were more deaths from measles at the end of the day.
Well, Benoit perhaps can correct me if I'm wrong, but I understand that in the DRC, actually, more children died from measles during at least an earlier stage of the Ebola outbreak and response. But certainly we are seeing increases in preventable diseases of children in many countries around the world. and we can only anticipate with disruptions in routine immunizations and disruption in our systems to deliver healthcare that we're going to have both near-term and long-term damage to health, and unfortunately a burden of disease that could have been prevented.
And Benoit is agreeing with that in the chat. Before we go to Michelle Flournoy, Peggy, one more question in this series. What don't we know about the coronavirus?
Well, there's a lot we don't know. As I mentioned, it's really only been 4 months that this virus has been with us. Very quickly, we learned about the genome of the virus. A Chinese scientist posted it early in January, and that enabled progress to go forward. We still don't fully understand how this virus is transmitted, how easily, and also the role of asymptomatic transmission, which is a little unusual. This disease, it seems more pronounced than in many other viral infections. We don't really fully understand the mechanism of spread, respiratory droplets, coughing, sneezing, versus aerosol spread, and how long can it stay on certain surfaces, and can virus found on surfaces actually cause infection. We don't really fully understand the nature of the immune response. We know that people develop antibodies after they've been infected. With most viral diseases, that signals some kind of natural immunity, so you won't get it again, but not always. And we need to really understand the nature of that immune protection, because now we're talking about using those antibody measurements, so-called serology tests, as a tool to decide who can safely go back to work on the front lines as healthcare workers or first responders, but also go back into their into routine workplaces, schools, social gatherings, et cetera. So these are important areas of science that we need to continue to elaborate understanding, and we need to learn from all the countries that have already had deep experience with this novel coronavirus.
Thank you, Dr. Peggy Hamburg. There are many questions for you in the chat. We hope you can stay a little longer. It's an honor to have you with us, and thank you. So now let's turn to Michelle Flournoy, CARE's Vice Chair of the Board of Directors. She was Undersecretary of Defense for Policy in the last administration. She's co-founder of the Center for a New American Security and West Exec Advisors. She's had many strategic roles in government and is considered one of the most respected leaders in our country of U.S. national security and defense. Michelle, has our U.S. national security planning adequately prepared us for a global health crisis like this?
Well, Beth, that's a great question. But before I address it, let me just say thanks to you and to Michelle Nunn and to the whole CARE staff for convening this conversation and for the incredible work that you do, especially folks like Benoit on the ground. We are all so grateful and proud of the work that you're doing, particularly at this difficult moment in time. I think the U.S. response, both at home, clearly, but also in terms of leadership in the international community, has been quite disappointing. I do think, though, that I'm on so many COVID-related calls where I feel so depressed at the end. I am going to try to highlight some things that may come out of this that I hope will make us stronger in the long term. So the first is that because almost every American has been touched by this, whether it's in their own health, the health of a friend or a family member, economic impacts, or they're just shut down and locked down at home, I think that the fact that we were not fully prepared for this, even though we could have been more prepared, is going to make this a national security issue going forward. I think there will be a new political imperative for any future president, that the ability to address public health crises here at home and globally will be seen as a national security issue. it used to be, Peggy will remember this, when we were both in government, we actually did planning every year for this. We had interagency exercises. But even so, it was always hard to get enough funding for the public health system and for the kind of preparatory measures that you would want to have in place for an effective response. I do think this may change over time. As people think about this as a national security issue, my hope is that they will be much more serious about planning for it, preparing for it, stockpiling for it, and resourcing the public health infrastructure that we need to have at the beginning of a crisis to be able to effectively address it going forward. The second thing I hope we will learn, and I don't think we're there yet because this is still spreading into the developing world. I hope that eventually Americans will realize, that we'll all realize, that effective response, as Senator Coons said, has to be global. That if we just focus on what we need here at home and we don't help other countries, particularly the most vulnerable, the disease will stay with us longer, the lives lost will be greater, and eventually that will bring waves back to the United States. And so I'm hoping that this will also increase public support, if not demand, for a more effective global response and funding for that response. The third thing that I hope will happen is, even though the US government may not be stepping up as fully as we would all like to see, the American people are stepping up, NGOs like CARE are stepping up, companies like Google and others are stepping up. The American society, other companies and NGOs around the world are stepping into the vacuum. And I think we're discovering some novel ways to work together, novel approaches to public-private partnership, and so forth. So I hope that will be a very positive legacy coming out of this. But the truth is, we have missed the opportunity so far as a country to lead on this issue. And I hope that will influence our choices of future leadership. I don't want to be too partisan on this call, but I do hope that we will have a leadership, return in the future that will enable the U.S. to play the kind of invaluable role that we can and should play on the global stage. But in the meantime, again, I think this will be seen more and more as a national security issue, and that will, I hope, help us resource public health and preparedness for pandemics in the future more effectively than we have to date.
Thank you so much, Michelle. We're lucky to have you leading us at CARE and leading our national security thinking in this country. We'll come back to you with some questions. Please keep your questions coming into the chat. We're getting some excellent ones. And before we get to that, I'd like to introduce Jim Moran, former congressman from Virginia and a member of the House leadership during his many years in Congress. He also served on the Defense and SFOP's appropriations subcommittees. Jim, we wanted to get your perspective. What can we expect from Congress on these issues in your view? And what about the election? We heard from Chris Coons on some of the challenges. Wonder if you could amplify that.
I'd be happy to, Beth, but I have to say, and I appreciate that Michelle doesn't want to be political, but it's not a political statement to acknowledge that this country has failed in its role as a global leader, and our response has been grossly lacking. We should have led the world in the way to do this. Instead, there are 5 countries who are best case scenarios. They all happen to be led by women, but they did so much better job in terms of addressing this. And that's just the facts. Now, I do think that segues a bit into the politics. This election in November, I think, will reflect people's perception of how well this administration and their individual representatives in the House and Senate dealt with this. very quickly, it looks as though the House is going to continue to be led by Speaker Nancy Pelosi, because even those 16 seats that were won around the country by Democrats, mostly women, 16 seats that Trump had carried overwhelmingly in 2016, they don't seem to be in danger. The women have raised an incredible amount of money. They've worked hard. They've been very effective. So, and then there's been a great many Republican retirements. In the Senate, it looks like it could be close. The Colorado, Arizona, Maine, a number of states have very close elections. So we'll wait and see. And in terms of the national elections, you all watch the polls. It looks as though we'll probably have a new president. But let me move from the politics, the polling, and so on, to segue from what Michelle said, and really the previous speakers. As daunting as the challenges that the coronavirus pandemic have presented this country and this world with, it also has to be an opportunity. It has to be a transformative opportunity to change things that really are the underlying causes of a great deal of strife and instability. There are two greatest threats to our political stability right now, and to some extent to our economy. And it's not the Russians or Donald Trump. One is the gross disparity in income and wealth, which has been exacerbated by the pandemic. And then the second is that we've got about 40 to 45% of our population that feels left out, that doesn't feel as though they're being valued, either economically or socially. And we have to address those, I think, and use this transformative moment as an opportunity to do so. I'm not suggesting that the federal government should take over much of the economy, but I am suggesting that we need a much greater sense of community. We need to all be concerned about the fact that 70% in many cities of the people who are dying are people of color, primarily African Americans, who have suffered from bad health throughout their lives. We need to be concerned about the fact we're going to have about 35 million people without health insurance because of the economic shutdown. And we're going to have about 1/5 of our people living in poverty, about 30% unemployment. Those numbers are comparable to what happened in the Great Depression. And that was a transformative moment. We had a leader emerge who found a way to employ those people. But I have to say, what we are doing now in response, while it's necessary, while it seems to make sense on the surface of it, it's very different from what Franklin Roosevelt did. What Franklin Roosevelt did was that he put people to work. He understood they didn't feel valued in the new manufacturing economy of the 20s and 30s, and he gave them jobs. And I think we need to find a way to show that people are going to have better opportunities when they emerge from this than they had beforehand. So I would hope that we would be creative. And I want to mention the fact that Chris Coons this morning had a press conference, and I'm sorry he didn't mention it, on national service. We need a national service where we can train people, where we can pull them out of their communities, away from some of their peer groups, and give them a better sense of who they are and what they're capable of. And that national service needs to be tied concomitantly with international service. We've got to beef up the Peace Corps. Those are some of our best ambassadors. In my generation, many of today's leaders, now they're starting to retire, but they really got involved in public service because they had an opportunity to realize what a difference they could make around the world. The Peace Corps desperately needs to be beefed up. And with all the money we're throwing out there that would be an extraordinarily important investment, as would national service in terms of a public health corps and in terms of infrastructure. The people that Franklin Roosevelt provided jobs for, they could see that they had accomplished something tangible. It was a life-changing experience, and it was a nationwide changing experience, and that's the kind of thing we need to be focused on. Now, I'm going to go on too long if you get on my soapbox here, but I really think that's where the emphasis needs to be. And we have an audience here of influencers who are of leaders who are the kinds of people that come up with the best ideas and then take the ball and run with it. So I hope collectively we can find ways to make a better use of the $6 trillion we're going to pump into the economy, come up with more creative ways to address this vast disparity in income and wealth in this country and really around the world, and find a better way of valuing everybody in this country so that they don't feel that the government and the people in the cities and on the East and West Coast are alien to their way of life. This needs to be an opportunity to pull our country and really the world through international organizations into a greater sense of community.
Thank you so much, Jim. And we want you to stay out there and keep saying those things. We'll come back to you in the question session. But before we get to that, CARE, as we've heard some about, is responding around the globe in more than 100 countries and in 63 with a specific COVID emergency response. CARE is also relaunching the CARE package to meet the new demands, and I'm delighted to welcome Chris Noble of CARE to tell us a little bit more about that. Chris, we're not hearing you.
How about now?
That's great.
There we go. Well, thank you so much. Thank you everybody for the time today. I just want to really quickly kind of follow Representative Moran's comments with the setup of our U.S. response. You know, there is a little bit of a vacuum of hope, and there's some question about what's going to move forward to fill that vacuum. And, you know, at CARE, we think very seriously about that. And again, kind of just to echo Representative Moran, to create a sense of community and to create room and opportunity for service is one of the leadership roles that we have around the globe that we can maintain and extend here in the US for the first time in our 75-year history. Not only is it needful in terms of filling that vacuum of hope, but it's something that we can uniquely do to do things that we do elsewhere in the world, helping to support the caregivers and the frontline workers so they can take care of others, and then reflecting on what the needs are of the most vulnerable in communities and finding a way to shore up those supply lines to enable stronger food security, to think about the lens of gender as it affects these issues, and really to do here in the US what CARE does everywhere else. Having thought through that, Michelle and the board set a mandate to really invigorate our US response about 4.5 weeks ago. And starting today and available to y'all tomorrow at carepackage.org, you'll be able to see the beginning of that response. It's in 3 buckets, and you can see these buckets on the screen here. The Care Package for Frontline Heroes is in conjunction with the American Nurses Association, Operation Gratitude, handful of other social impact associations and nonprofits to identify the folks who are on the front lines, nurses, grocery clerks, public safety workers, people who are still going out there and risking exposure to COVID while we're sheltered safely here. What we're going to do is to tap into that greater sense of community and to tap into that urge that we all have to do something more with a consumer-facing campaign that's got a lot of corporate support, so that I, as an individual, can go to carepackage.org, immediately send a care package, which is a digital gift card to start, to someone on the front lines that I know, or I think better still, to send anonymously to someone who is just in need of having their day lifted up. They've been at it 36 hours, they're gonna go another 2 or 3 hours. Just a little digital gift card, message of support, $25 typically to help buy coffee or a healthy snack or something. The program is live now. We'll serve our first 3,000 nurses in New Jersey over the course of this week. And we are already getting financial and corporate support from Gap Foundation, from a handful of others. The second major area is the care package for neighbors. And again, that taps into the community vibe. So that's it stands up right now in San Francisco, and it's a gig economy platform for humanitarian relief. So partnering with Postmates and DoorDash and others on the gig economy side, partnering with social impact partners, food banks primarily, to fix 2 problems at once. Food banks are in need of volunteers. There are unemployed and underemployed folks all around. And so this platform has philanthropic or state-funded dollars going one end to create a pool that then hires people in a gig economy fashion to run errands, provide critical goods and services. Again, that's up and running in San Francisco this week. We expect to be launching in Atlanta in the coming weeks, and have a pilot going with Reverend Al Sharpton's National Action Network, delivering food to the most vulnerable in Harlem and Brooklyn and some hospitals also this week. So that's what we're doing. Again, it's in the spirit of service, trying to tap into that sense of community and give people some place to direct their energy, either to help those frontline heroes or to help the most vulnerable among us.
Thanks so much, Chris. And that's excellent. And is there a global care package as well?
Yeah, of course there is. And I was going to let other people talk to global, but as you'll see there, if you go to carepackage.org, it flows through and funds our existing global efforts, hand washing stations, hygiene kits, things like that. And that lines up exactly and directly with our mission in the 63 countries around the globe right now, where we're working to provide relief.
Thanks so much, Chris. It's excellent. Rachel, let's take some questions from the chat. Rachel, we can't hear you.
Sure. We can take some questions from the chat. One of the questions that I can see, and some people are messaging in a smaller group. One caller wondered, what is happening as care has turned towards COVID-19? What is happening to care's other priorities? How are we balancing this, and what's the best way to help?
Michelle Nunn, do you want to speak to that?
Sure, I can jump into that. I will say that I think that just as the world has been overtaken by COVID-19, so care has been overtaken by COVID, and so we have been busy reconstituting our own operations, for instance, in terms of how we operate, and then lifting up our programmatic response. But at the same time, we've also been focused on our humanitarian mandate. So, as an example, in Ethiopia, our team has continued to be working on providing literal food for people who are in danger of not having it because of locusts, as an example. So if you imagine, we talked yesterday to our colleagues in Yemen, layer upon layer of conflict, of cholera, of the absence of any form of livelihood, of water and sanitation, and then COVID. So we are continuing with our humanitarian mandate and then layering on our COVID response. And I think we're also preparing for the enormity of the economic challenges and the food security challenges that are already a part of this, because as we all know, this isn't just a health crisis, this is an economic crisis, and will quickly become, and already has for many people, a food nutrition security crisis. So we have our work cut out for us. The way that people can help is your continued support of CARE as funders and as advocates. You heard from Senator Coons about lifting up your voice. It's incredibly important to do so at this juncture. And I hope that we can build the kind of solidarity that, that our panelists spoke to, and use this moment as an opportunity.
Thanks, Michelle. Another question from the chat for Michelle Flournoy. Does the focus on COVID-19 open the doors to threats from non-state actors and other sources?
Certainly, at a time when we are all very preoccupied with this particular crisis for understandable reasons, it does create an opportunity for both state and non-state actors who might want to either pursue, their objectives or test our resolve to make mischief. We've actually already seen a little bit of this by China in the South China Sea recently, both Chinese Coast Guard sinking a Vietnamese vessel in disputed waters, and also making 80 new claims of geographic claims in the South China Sea as this pandemic goes on. So we definitely see that opportunity for potential rivals or folks who would do us harm. I think it's one of the challenges the U.S. military is facing, is that on the one hand, they have to keep their own people safe. We saw what happened on the carrier, the Theodore Roosevelt. But at the same time, they also have to preserve their readiness and make sure they're able to respond to other crises around the world and to defend and protect our interests. So this is a really challenging time for the U.S. military, but for, frankly, all of the U.S. personnel on the front lines. That includes diplomats and aid workers and others as well.
Thank you, Michelle. We have one for Peggy Hamburg. How will the COVID-19 response evolve if antibody development does not create immunity and reinfection waves occur?
On target question, I do believe that it will confer some immunity. There's every reason to believe that based on what we know about other coronaviruses, because while this is a new coronavirus, we're familiar with coronaviruses in the family, some which just cause the common cold, and then the more serious disease of SARS and MERS. But a critical part of that question is, how strong is the protection? Can you distinguish the components of the antibody response, because there are different kinds of antibodies, to know which are the subset that are actually giving you protection against infection, and how long will it last? Because if we're building strategies for going back to the workplace, et cetera, we need to understand that. And some people are even saying, if we have limited vaccine, we'll distribute it on the basis of your antibody profile. And if you've developed antibodies, then you won't be able to get it. But I think that, the sad truth is, if the antibody response mounted to the virus is not very protective in this particular instance in terms of natural immunity, it's going to raise the bar for our ability to make an effective vaccine. It may mean that we have to do the vaccine in ways that potentiate the immune response more strongly, and that sometimes can raise safety concerns. It may mean that one vaccination won't be enough and we'll have to do multiple boosts. So all of that is tied in, and all of it is very, very important to the future management and control of this epidemic.
Thanks so much, Peggy. Unfortunately, we're out of time. We have so many more questions, but this has been an excellent discussion, and we're so grateful to our speakers. Michelle Nunn, would you like to offer any thoughts before we conclude?
Just a huge thank you to Beth and your team for bringing us all together. I know that I feel both daunted, but also sort of reassured that we have the extraordinary assemblage of leaders that we've heard from today, and Michelle and Peggy and Benoit on the front lines, and Jim and Chris, obviously. And so I think you've all given us reason to be hopeful and to fight for a future that can ensure ensure that we have greater equity and social justice for all, and to move through this with some degree of commitment and conviction that we will rise to this occasion. So thank you very much. Thank you all for being supporters of CARE and for lifting up our global community at a critical time.
Thank you, Michelle, for all your leadership. And we have a slide that shows 2 links where you can go. Of course, Chris mentioned www.carepackage.org, and you can also go to care.org/GLN for Global Leaders Network. Thanks again to our sponsors, Google, Huntington Ingalls, the embassies of the UAE and Qatar, and the Goldman Sonnenfeld Foundation. And we'll look forward to being in touch in the days and weeks to come. Thank you for your support for these efforts, and stay safe.